Hi and welcome back to my channel TLCKP, and welcome if you're new. I'm a disabled mum of 3 and will be posting videos on family life, being a disabled mum and bringing up a baby whilst being in a wheelchair. Please like this video and subscribe to my channel if you could. Please feel free to comment on anything you would like to see from my channel. So today's video I'm going to discuss, as says in the title, I'm going to talk about my pregnancy and birth stories from all 3 of my pregnancies. So with Chloe, Kai and Penny. I will start this video by saying that with Chloe and Kai, when I was pregnant with them, I wasn't in a wheelchair. I was fully able-bodied and didn't have any of my physical limitations that I do now. That didn't happen until 2009. So if I start right at the very beginning with Chloe, who is the eldest, she will be 17 in February. So she was born in 2005. I'll do my best to remember exactly what I can. I have wrote down some notes just because it's a lot to remember and to try to refresh my mind. There are bits that are fuzzy, but I will remember what I can. So when I found out I was pregnant with Chloe, I was only 18, so I was very young. It was quite a shock to the system, for sure. It was definitely a shock to my family, but I definitely had the thoughts going through my brain, as I'm sure anybody does when they're not in the ideal situation, of can I do this? Am I capable of doing this? Especially at a young age. Now, the thoughts did go through my head of, what do I do? Am I really stuck now? What do I do? But I made the choice that was right for me at the time. And for me, the choice was to continue along with the pregnancy and hope everything went well. I had had a previous miscarriage, so I was hopeful that things would be okay and that I wouldn't have to experience that again. I remember being at an old school friend's birthday party, not drinking, in case you were wondering, and needing to go to the toilet, feeling stomach pains. I went into the toilet and found out I was bleeding quite heavily. So I can't remember exactly what I did. I believe I phoned up the hospital and I believe maybe even went to A&E. So I ended up in early pregnancy unit. I then, which is the hospital, the way things work in the UK, if you're under a certain gestation, I believe you are responsible for, the early pregnancy unit are responsible for you. So that is where I ended up. I think I was around about 6 or 7 weeks pregnant, so not very far along. I then explained that I was having heavy bleeding. They then did an ultrasound scan and they found out that they explained that baby was completely fine. But based on what was left over and the amount of bleeding and what I was losing, they explained that the only thing was that she must have been a twin. So I lost her twin. The thoughts that were going through my head was, oh my God, I could have had twins at 19 years old. It would have been interesting, but that wasn't the way that wasn't meant to be. Now, there are lots of twins and triplets and things like this scattered throughout my family, so it wasn't a surprise in that respect, but it was in the respect that I had lost one of the twins. But anyway, so the next few months of pregnancy were pretty straightforward. I was under the midwife I actually had 2 midwives, so I just saw them back and forward at a midwife unit. I then found out at the scan I was having a girl, which I was extremely happy about. I'd grown up with girls, so I didn't know anything about boys bar cousins, and I hadn't lived with them, so I didn't really know. My midwife then told me about a local antenatal group, which I did go to the first time, and I felt like the odd one out. It felt to me like I was immediately judged because of how young I looked and obviously was. And there were all these older women, and I felt so self-conscious and judged. I don't know whether or not there was, but that's the way I felt. I felt extremely uncomfortable, and I was clearly the youngest one there. So I never went back. I spoke to my midwife, and she then explained that there was another group, that there was one specifically for young mums. And suddenly I was the oldest one there. I was 18 and a half, well, nearly 19 at this point. I believe I was 19 at this point. And I was literally the oldest girl there. And it felt so much nicer to be around people closer to my age than I had done before. I felt more comfortable. I felt just less judged, I suppose. At around 6.5 months, I believe I was 6.5 months pregnant, I started getting really terrible lower right abdominal pains. And yes, right around where my appendix is. I then phoned up the hospital, went up there and explained my problems. They felt around. They said they definitely felt, it felt painful when they pushed where my appendix would be. But they said the biggest issue was that the only way to know for sure if it was my appendix was to operate. And if they were to do that, they would operate as though they would remove it. But they couldn't leave it behind once they were there, because even if it was completely fine, and it definitely wasn't my appendix, the way they explained it to me is if, for instance, in the future I was unconscious for whatever reason and someone suspected appendix related problems like appendicitis, they might look and see I had a scar there and think, well, she hasn't got an appendix, so can't be that. So they then said, we need to be sure, and obviously being 6.5 months around about pregnant, that it would have been more dangerous for baby. So they then waited for a few days, but during this time I then started to have contractions, which made a complicated situation worse. I then had to stay in hospital for a little while to monitor the contractions. It even got to the point of where they gave me a steroid injection in case she came early. There were other people on the ward that I was on, also pregnant, who were even going for scans to check baby's weight to see roughly how much they would weigh if they came prematurely. They didn't do that on the scans like they do now back then. So I stayed in, they monitored me. Like I said, they gave me steroids just in case she came prematurely, to make sure her lungs were properly developed. And luckily the contractions died down, everything died down, and I went home. So then pregnancy carried on as normal. So fast forward right to the end of the pregnancy, at my last midwife's appointment, they confirmed that baby was head down, that Chloe, sorry, was head down. Her head was engaged, everything was looking good. They even said that if I didn't go into labour beforehand, that they would induce me at around 12 days overdue. So I left thinking, yep, everything's great. Then it was about 6 days, I was 6 days overdue. So on the Saturday, 6 days past my due date, I woke up in agony. It was the worst pain, one of the worst pains I'd felt up to that point. A lot worse than with the appendix related pain, or suspected appendix related pain. It was awful. It was lower, it was right down low, lowered stomach / pelvis area. I immediately phoned the hospital. They said to come up straight away. So I did, and I said to the doctors, she's now kicking me under my ribs, whereas previously, literally the day before, she'd been kicking me down in my pelvis. And I was like, I know where her feet are. And they didn't believe me at all. Maybe because I was young, I don't know, maybe because I was going to be a first time mum. I don't know, but they just didn't believe a word I said. And I kept telling them, I know she's head down, that she's gone breech. I know this. And judging by my notes and speaking to the midwife, they was like, nope. Anyway, they reluctantly did an ultrasound scan, and shock horror, they found out that she was in fact now completely breech, and then immediately decided that the first port of call was not to try and term her, which later on my midwives then told me would have been the first thing they would have suggested, and would have thought the doctors would have suggested, but no, they said that I had to have a cesarean section. So they went, right, we need to book you in today. And of course I was like, hold on a minute. And I was so scared and I didn't know what to do. So luckily for me, not for the other ladies, but luckily for me, there was too many emergencies that day. So they decided to delay it till the Monday morning. So I left. I was freaking out big time over the weekend. I was worried. I was stressed. It was not a fun day and a half wait. So come Monday morning, I went up to the hospital. So I ended up giving birth via cesarean section on the Monday just before midday. My mum was even in the room with me because I was so scared, and she even got to cut the cord, which she still speaks about to this day and is still glad that she got to do. I'm really glad she got to have that experience because not many nans get to experience that. So I had her at 41 weeks plus 1 day gestation, born via cesarean section, and she was born a healthy 7 pounds 8 ounces, which I think is quite a good weight for considering she was over a week late. It was overall a positive birth experience in the end. So with Kai, it was early 2007 when I found out I was pregnant with him. To begin with, most of the pregnancy was relatively straightforward. I found out that I was going to be consultant-led at the midwife's appointment due to my previous cesarean section. I had all-day sickness rather than just morning, just like with Chloe, so there was no difference there. We found out we were having a boy at our 20-week scan, just like with Chloe. I found out at the 20-week scan. Then maybe 1 to 2 months after the 20-week scan, I then started getting cystitis, regularly, or what it felt like all the time. I didn't really think much of it due to having regular cystitis prior to pregnancy anyway, so I didn't really think much of it. Like I said, I was consultant led, so I didn't have regular midwife checkups to run it by or have your wee analysed like you do when you're midwife led. So I didn't really think much of it until it got a lot worse. I then got to the point of where I would have dinner and I would be sick straight away. I couldn't keep anything down. So I phoned up the maternity unit at the hospital. They advised I went up there just to see what was going on. I got my sister's boyfriend at the time to drive me up there, as I didn't drive at the time. We went in and I explained my issues. I believe they did a wee sample and figured out that I had an infection. They investigated more and it actually turned out I had quite a severe kidney infection. I didn't know what... I'd never had a kidney infection that I'd known of before. I ended up having... They said I was extremely lucky for it to have been caught when it did, because it was quite severe. I had some quite strong antibiotic treatment and ended up going home. So luckily it got bad at home when it did, so that it didn't get to the point of needing to have my kidney removed, which wouldn't have been fun, especially not when heavily pregnant. I finished recovering at home, and then at the beginning of the December, I started getting frequent pains, and similar to when I was getting contractions with Chloe, and so I thought, this is not quite right. It started getting extremely painful. I ended up going up to the hospital. I found a maternity ward. They wanted to check me out, and I was having contractions. And they examined me, said I was about 1 to 2 centimetres dilated. They even gave me some pethidine. That was fun. But then I wasn't progressing at all, so they sent me home. I then spent the next roughly 3 weeks in early labour without really any progression. I was kept an eye on, but there wasn't really any progression. So, as I said previously, I was consultant led, so at all of my consultant appointments, due to having a previous caesarean, they were very insistent that I should have another caesarean, and I was very insistent that I not have another caesarean and that I wanted a vaginal birth. So I believe it's called a VBAC, so vaginal birth after caesarean section, and that is what I wanted. I was very insistent, and my husband came to all of my consultant appointments just to ensure, not that I had many, but just to ensure that they didn't try to tempt me into it, because they did like to try to do that. So at this last consultant's appointment, unfortunately I had to attend by myself because my husband couldn't get the day off work, and they did exactly what I expected them to do. They pushed and pushed for me to have a caesarean, and I reluctantly agreed. They went through all the problems of having a vaginal birth after a previous caesarean, and I agreed. And I'm still, to this day, I'm still annoyed at myself for the way that they pushed me and the fact that I let them do it. I let them push me into a decision that I wasn't personally comfortable with. But they booked the cesarean in for the Friday before he was due. He was due on the Tuesday, which was actually Christmas Day. And they booked the cesarean in for the Friday. So I would have been 39 weeks plus 3 days gestation. And that's exactly what happened. I did try to get out the cesarean that morning. I did say to them I wasn't comfortable, and they just said that I had no choice, that it was something I had to do. So on the Friday morning at around 10 o'clock, he was born a healthy 7 pounds and 14 ounces. And then in November 2019, I found out I was pregnant again. Out of the blue, I was pregnant. We had discussed having another baby after Kai, but never happened. And obviously I come in the wheelchair in 2009, and so my health changed. But then in November 2019, found out I was pregnant. We were very surprised. I was about a week late on my period, and then I did a pregnancy test just to make sure. So I then found out, I did the pregnancy test, we found out it was positive. We were surprised, to say the least. I then booked a doctor's appointment because I was on a lot of medication. Went to the doctors, made a plan to come off of some of the medication, and had to immediately stop one of them, and made a plan to lower some of the others. I then told family on the Friday and Saturday of that week. Been to the doctors on the Thursday, told the family on the Friday and Saturday. I then started getting terrible pains on the Sunday, so at around 6 weeks roughly. I thought, this is not good. I then started bleeding ever so slightly too, and flashed back, to be honest, to previous miscarriages, to the bleeding during pregnancy with Chloe. So my mind was all over the place, my emotions were all over the place. I didn't know what was going on. Went up to A&E, and they did a pregnancy test. They then sent me up to, I believe it might have been the early pregnancy unit, and because it was late in the evening by this point. They did a scan, and they weren't entirely certain what was going on. They said I was probably too early on in pregnancy for them to really know what was going on, but they'd confirmed that I was pregnant by the wee sample they'd taken. They'd also confirmed that I was bleeding. So I had blood tests they took to determine the HCG levels. I then had to go back a few days later to have them repeated. I think it was about 2 days later. During this time, of course, my mind was, please double, please double. And of course it didn't. It went from 600 and something, I believe it was, down to 90 something. So it was clear that I had had a miscarriage. Please do accept my apologies for the change in outfit. It is actually a different day. Unfortunately, I experienced some technical difficulties during the filming of Penny's section, so I'm having to refilm that. I found out I was pregnant with Penny on the 3rd of July in 2020. Now obviously this was a difficult time for many due to the ongoing coronavirus pandemic. Not that it's not ongoing now, it still is. But it was particularly bad at that time, and obviously it only recently started in the UK. So I immediately booked a doctor's appointment to discuss all the medication I was taking, and because of my previous miscarriages, and I'm not really sure what else, but my GP actually prescribed the higher dose folic acids. I was actually on 5 mg tablets, I believe it was. I was also taking Pregnacare supplements, which also included folic acid. So I also take an iron tablet anyway. But yes, so they put me on the higher dose folic acid, and I was getting heartburn and some acid reflux and things like that during pregnancy, but I was already taking the medication that they would prescribe anyway, so unfortunately there was nothing more they could do about that. So towards the very beginning, I began vomiting quite frequently, and it was quite severe. I would get quite bad stomach pains after actually eating, but a certain amount of time after eating I would get severe pains in my stomach, and I would, like I said, vomiting like so many times during the day. I can't even think how much. It was just all the time. I honestly thought something was quite severely wrong with pregnancy, maybe. But I do have to mention that, and this is what it actually turned out to be the cause by, but I have a stomach condition called gastroparesis, which I believe, anyway, that I got after I had my gallbladder removed in May of 2018. So when I started getting all these stomach pains and the violent vomiting and frequent vomiting throughout the day, I did contact my dietitian. So yeah, I contacted the dietitian about a week or so after finding out I was pregnant, just to figure out what was going on, and she actually suggested going on a completely soft foods diet, so not quite as severe as complete liquid. So it was a completely soft food diet, so everything was blended and it was extremely soft, like soup, I would say, consistency. I did eat a lot of soups. I also had to go on some high calorie drinks, which I was previously taking. I had to increase the quantity of them, which they had to be dairy free, because see, I was dairy free, still am. So yeah, they weren't nice at all. This entire period of time was not nice, and after about, I would have to say about a month or so, I just couldn't take it anymore. I just couldn't take the foods. Please excuse Penny if you can hear her in the background. She's not very happy, and it is nearly her bedtime, so she's getting quite tired. But yeah, so after about a month or so, it started to settle down. I think I'd given my stomach such a break from having to digest the foods, which is a problem with gastroparesis, that it just became easier to deal with, I suppose. I will say the vomiting didn't stop, and still hasn't to this day. It is so much better than it was, and so I'm glad of that. I'm glad of not being sick 20-30 times a day, and instead a handful of times a day. So I'm glad because of that. So after this point, or during this point, I actually did find a Groupon deal and booked an early reassurance scan. Because of my miscarriage at the end of 2019, I was extremely concerned and worried whether or not I would miscarry again. I mean, anybody who's been through it or is early pregnant, especially if you've had miscarriages like in the family environment, or anybody you know really, they're extremely common but not spoke about a lot. So anyway, so I did book a early reassurance scan through a company called Window to the Womb. I do have to say they were very good. Not that this is sponsored by them at all, but they were very good, and we saw them, I think, 3 times throughout the pregnancy. But yeah, so that was around 7 weeks, and they confirmed to my wildest dreams that everything was okay, and I was confused and happy, very happy that everything was okay. We then told Chloe and Kai that everything was okay and that we could go along. They did ask if we were going to tell family, and I did say not at that point. I just wanted to make sure. You know, I wanted to get through the first NHS scan, the dating scan, just to confirm everything was okay. Because I do know people that have gone through terminations for medical reasons when they've gone for their NHS dating scan at around 12 weeks. So anyway, so around 9 weeks we had the midwife's appointment, where she did explain that because of my previous 2 cesarean sections that I would be consultant led once again, which was not a fun time. I didn't love the idea of that due to everything that happened with Kai. She also suggested that I have a mental health midwife's appointment, just to confirm that, because after Chloe I did possibly suffer a bit of postnatal depression. I'm not certain, but I did struggle a bit with that. So she suggested that I just check in with one, just to have a conversation and go from there, basically. I then got called into the hospital to have the dating scan. Now, originally they told me that I would have to come alone, and this was due to COVID, but that because my husband is my full-time carer and I would need his help getting from the car, out of the car, into the hospital, up to the scan, and then actually onto the chair bed thing that they put you on. And so they did agree that he could come, luckily. So I think they confirmed I was around 11.5 weeks when I had the dating scan. They did say everything was okay and said my due date was around about the 9th of March 2021. But I would have to come back around 10 days later just to allow them to complete some of the checks that they can't do until you are officially past 12 weeks. So that's what we did. Once again, they confirmed that everything was okay. And it was around that point that we did decide to tell our friends and family, and we also did announce, well, I did announce on social media too. So then around 16 weeks, we decided to go back to Window to the Womb and have another private scan. Again, it was a Groupon deal, luckily. But yeah, we decided to find out the gender. And so basically a few days before the scan, we bought a gender reveal balloon from Amazon. We did go back and forward about ways to do this, but we chose the balloon as we could do it inside, and it was not the best time to be outside and things like this. So we did decide to do that. So we just got one. It's just said gender reveal. I think it's an IMA, and then something like that. And inside it, basically with it, you got 2 packets. You got blue confetti with, I believe, either silver or gold with it, and you also got a bag of pink confetti with gold and I believe rose gold in it as well. And so we went to the gender scan, and I remember being in the room, and the lady that was in there with the sonographer turned around and said that if it was a boy, that we would see what looked like a rocket in between baby's legs. Now, when they showed us in between baby's legs, and they was like, "What do you think?" And in my head I was thinking, I don't want to sound silly, but I can't see a rocket. But what if I'm wrong? And so I just said, oh, I don't know what I can see. So anyway, so then they wrote on the screen, it's a girl. Honestly, I cried. I was so shocked. I'd almost convinced myself that Penny was going to be a boy. Just because of, with Kai, basically. When finding out Kai was a boy was quite a shock. So I was quite surprised that Penny was actually a girl. On the way home from the scan place, Luke filled the balloon with the pink confetti and blew it up. And once we got in, Chloe and Kai obviously were quite anxious to find out what we were having. And we held, like Chloe and Kai both held the balloon up, and Luke went up to it and popped the balloon with a pin whilst I filmed their reactions. And it was so lovely to see. It was really lovely to see their reactions, and even to look back now. And I do think the video cuts off just like a couple of, maybe like a second before Chloe starts crying. But she was so overjoyed, and they were both in shock, and it was such a lovely reaction. And I'm glad we did it that way. I then created a WhatsApp group and sent it to my family, sent the video, and everyone else was overjoyed too. I mean, my sister had recently had her daughter in the June of 2020, so there was lots of new granddaughters from my mum, and yeah, everyone was really happy, so it was really lovely. It was really lovely. But it was around this time, around the 16 odd weeks, that we first had the consultant's appointment and first saw the mental health midwife. Now, the consultant that we saw, who I did believe was my named consultant, turns out she wasn't in the end, but we didn't know this till the very end. But she did suggest that because during the booking appointment with the midwife at 9 weeks, I had a low-ish weight. My BMI was quite low because I am on the taller side, I suppose. And so she suggested that I have growth scans at 28, 32 and 36 weeks, I believe. So she also said that I had to have a glucose test to check for gestational diabetes at around 28 weeks, because my mum's mum, my nan, had diabetes. She had type 2 diabetes though, but my sister, she actually developed gestational diabetes towards the end of her pregnancy. So I pretty much thought I was going to have a glucose test anyway, as I did with both Chloe and Kai. Not because of my sister back then, but because of my nan, so I wasn't surprised. So the mental health midwife, she was actually really lovely actually. We spoke, and she did confirm what I had previously, I suppose, hoped and thought, that I didn't need mental health support during my pregnancy. But she did, however, pick up on exactly how anxious I was regarding only being consultant-led after what happened with Kai. So, because she was, in fact, a qualified midwife, she did ask whether or not I wanted to see her throughout my pregnancy for regular midwife checks. And so I was really overjoyed with that. So I'm glad I agreed with that. We then attended the 20-week NHS scan on the 20th of October 2020, where they luckily did confirm there was no anomalies found at that time, and that she was indeed still a girl. But 2 days later, so on the 22nd of October, I remember I had a shower that morning, and after I got out, I had quite a lot of pains. I felt really sick, and I had a lot of pains, kind of just here, so just below, just around where the bottom of my bra sits, I suppose, right in the middle, and all the way down my right arm. It was awful. But yeah, so I came downstairs. I do have a stair lift. I came downstairs and my husband made me lunch. So I had a couple of bites of it and immediately was sick. I had some water to see if it would help, and again, immediately was sick. And everything I tried to drink for the rest of that day, that's all I would do. I would be sick. I then was, the pain just got worse and worse. And if I'm completely honest, however silly it sounds, I really did think I was possibly having a heart attack, because that's what it felt like. Extreme pressure on my chest area, and it hurt to breathe. I remember just holding my breath for a couple of seconds to see if it would help, and it did, but not loads, but it did help. So every maybe half hour or so I'd do that just to give myself some amount of relief. Not that it gave me loads, unfortunately. So early evening, it got to the point where everyone was just saying to me, you need to call like the emergency services. So I didn't feel it was drastic enough, should I say, to call 999, but I did call 111, which here in the UK is like a semi-emergency service. They kind of can put you on with a GP, like an on-call doctor, or they can arrange for ambulance to come to you or things like that. So that's what I did. I called 111 and they went through their questions and I could barely answer them. I was in so much pain. But they sent out a paramedic car and the guy was really lovely. He came out immediately. My husband immediately said that I was 20 weeks pregnant and gave him my maternity notes and explained the medication that I was on. And he gave me paracetamol through a drip in my hand. He also gave me gas and air. First time I'd ever had that. I had to learn how to do it properly, because otherwise it wasn't quite doing anything properly. But yeah, so, and it just, nothing he was doing was really touching it. He did call the number on the front of my maternity notes, so the antenatal ward or maternity ward maybe, and just got some advice from them. But they said because it sounded more like a medical issue rather than a pregnancy issue. So they said I needed to be checked out medically first, as in I needed to be checked out first before they checked on baby, which I understood because I didn't think it was anything to do with the pregnancy, like anything wrong with Penny. So he called an ambulance. The paramedic actually called an ambulance to come as quick as possible. I did forget, he did an ECG on me and it all came back completely fine. So when the ambulance arrived, or just before they arrived, sorry, the paramedic told Luke to pack an overnight bag for me, and also informed Luke that he wouldn't be allowed to come in the ambulance with me, which I've got to admit I was not happy with. I was quite scared and quite anxious that I would be on my own. It's not as easy for me. If anybody's in a wheelchair or is disabled or relies on somebody for help, you'd rather rely on somebody you know what they're going to be like, and you know how they work and how they operate, and they also know, more to the point, they know what you like and how you like things to be done, and you know where not to pick you up from. Like for instance, under my left arm is bad from previous surgery. So, but yeah, so I was quite scared to go up there by myself. And I mean, I didn't have my wheelchair up there with me, and basically, I'm getting ahead of myself, but basically the entire time I was in hospital, I was stuck in a bed if I wasn't on a commode to go to the toilet, which they wheeled over the toilet. It was not nice for me at all. But anyway, so once we got to the hospital, they did a blood test, and they actually confirmed that what I was experiencing was actually pancreatitis. And they thought that I had a gallstone stuck. Now, if you remember rightly, I said earlier on in the video, I don't have a gallbladder. Haven't had since middle of 2018. So 2 and a bit years prior, I had my gallbladder out. So how could a gallstone have been stuck for 2 years and me not know anything about it? Now, I do have to say that these pains that I got that day in my chest and in my arm, that wasn't the first time I'd felt them, and I had done prior to pregnancy, since basically, I believe since I had my gallbladder out basically. But it was the first time that I have had to call 111 and call an ambulance for them, because they were just, pain was just unreal. It was just awful. So basically I spent the next 5 days in hospital alone. 4 nights, 5 days, and I did count. I couldn't see anybody, even when my husband came up to the hospital to bring some things up for me, because obviously we didn't expect me to be in for so long. I didn't see him. He had to drop them off at some office thing, at some desk somewhere, and then they brought them in to me, so I didn't see him. I did speak to Chloe and Kai over video call, and also Luke and my mum, I believe. But yeah, so that's all I could do. All I could speak to people was over video call, and some other people too. But all I ate while I was in hospital was jelly pots, basically, and orange juice, because I was in agony when I ate. So whilst I was in hospital, I remember the midwives coming down because I was concerned about Penny's movements. Because I had an anterior placenta, which meant my placenta was actually at the front. Basically, they described it to me like a big cushion between baby and you, basically, at the front. So you can't feel baby's movements as much. It's like they're kicking through a big fat cushion, effectively. So yeah, so they did her heartbeat and things like that. But basically, so at one point the doctors asked me to have an ultrasound scan just to check on my pancreas and where my gallbladder used to be, and ducts and other things. I remember being in this scan, and the man that did the scan was like, he said, I can't tell you anything about baby, whether or not she's okay or anything about her, but would you like to see her? And I was so grateful, completely and utterly. Oh, I loved it. Like I said, I was grateful to the midwives for checking her heartbeat when I was anxious about whether or not I could feel her moving or not. But to see her on that screen was just so lovely. It really was, especially with how bad I felt, how much pain I'd been in and things like this. So it was just nice just to see her wriggling around and just to see her moving, really, and know. But anyway, so I went home on day 5, and then over the coming few weeks I was able to increase what I was eating and how much I was eating, and get back to more solid foods. But still had to be, I was still cautious because of the gastroparesis, because I didn't want to feel what I felt at the beginning of pregnancy, and I didn't want to feel that pancreatitis pain again. Not that I'm saying that would have caused it, but I was just still a bit anxious of it all. So we then decided that an option that wasn't available to us with Chloe and Kai, so we decided to get a 4D scan done. We got a special offer for window to the womb. You could have guessed that one, eh? So because of my anterior placenta, they did advise us to get it done a bit earlier. And judging by a video that I have of that scan, I can tell you that I had it at 26 weeks and 6 days. It did take a while to get her into a decent enough position. I do remember we had to leave and go off, and we went over to Costa, there was one near, and had a drink and then had a hot chocolate, I believe. Dairy-free one, very nice. And then we went back, and luckily she'd moved, not loads, but she'd moved enough to be able to see, to be able to get a decent 4D picture, I suppose, of her head. So she was like this, and yeah, it was really sweet. And we got a picture of her foot as well, I believe, in 4D. So it was really lovely. It was a really lovely experience, and I'm glad we did do that. So whilst we were there, as with, I believe, the gender reveal scan, they checked over Penny just to make sure she was okay, I suppose. Now this is where they discovered a small problem, basically. They found a section of fluid near her heart. Now of course we were like, okay, a bit confused, didn't know what was going on, but they just said try not to worry, and that it wasn't extremely large, that they would refer us to the fetal medicine unit, I believe it was, at our local hospital, and that's what they did. We did get a phone call from the regular scan department at my hospital. I believe it was later that night or the following day, asking us to come up, that basically we'd been asked to have a scan to check on some abnormality. So I was like, a bit weird, but okay. So we went up there. They did notice, they saw the fluid. Window to the Womb did provide a report and pictures and things like that. But anyway, so they did see it for themselves on the scan, and they booked for us to come back 2 weeks later just to see, basically. I mean, I did have my 28-week growth scan a bit later, so I believe that was when we went back and they kind of rolled it into one, if you like. And so I remember seeing the mental health midwife, as she was at that point, just my midwife, and mentioning a couple of things to her. So I mentioned about the fact that we were supposed to be seen by the fetal medicine unit, and I also mentioned about some quite severe pain that I'd been getting in my pelvis. It was agony. I remember laying in bed and the pain was horrible, trying to, when just laying there, just having my legs close together, like when my husband turned me over, like moved my legs, it was agony. And so anyway, so I mentioned that to her, and she basically said that she thought I had SPD or PGP, sorry, just reading what it was, I can't remember the right letters for it. So yeah, so she basically suggested that I have a word with the consultant at one of my appointments, just to speak to her about maybe bringing the cesarean forward, because it was booked in for around 39 weeks, I believe it was. But to bring it forward to around 37 weeks, just over 37 weeks, which is technically classed as not premature. So it's like a safe, normal delivery, shall we say. And so just before further restrictions were put in around my area, I believe it was around the middle of December, I remember going around to my sister's, and I actually remember feeling like, just before we left, I remember feeling like, oh, did I just wet myself? As that's what it felt like. Just no control at all. Just like water leaking out of me, basically. And so I remember getting home, and I'd stopped off at a supermarket like Sainsbury's on the way home, and just checked that I wasn't bleeding, and luckily I wasn't, but my underwear was extremely wet, and it was clear, just clear fluid, basically, clear liquid. And so I had no idea. I mean, didn't smell like whey at all. Bit too much information, I suppose, there, but yeah. So once we got home, I put a pad on. I then kept an eye on it. Did have to change the pad, I believe, once in the morning. But yeah, I kept an eye on it. And because it was still happening in the morning, I did phone the antenatal unit, and they suggested that I go up straight away, and I went up. They put me on the bands they put around you, just to check Penny's heartbeat and check any contractions or anything like that. And whilst I was there, they also did a swab, I believe it was, just to like dip into something. I'm not really quite sure, but it was put into something just to see if there was any amniotic fluid, I think it was. So luckily there wasn't. We also had a repeat of this, basically exact same scenario, on Boxing Day. So again, went up to the hospital. Again, they checked. Again, everything seemed to be okay. So the fetal medicine unit did eventually see us, because the mental health midwife, I don't know what she did, but they saw me. I had a conversation with one of the midwives, and they got me in to see the consultant about 2 days later. So I remember being out in the little corridor thing where everyone had to wait, socially distanced, obviously, and they literally, this young girl came out, and she called me in, and my husband got up, and she was like, oh, no, you can't come. And we was like, well, she needs help getting on the bed, and etc, etc. She was like, no, I'll do that, that's fine. We can only have 3 people in the room, as it was some COVID rule, I suppose. So basically it was the consultant, the student, and me. And to be fair, I'm not overly happy about that, because why did the student need to be there? She didn't do anything whilst we were there. She just sat there effectively writing notes. So my husband could have come in, could have helped me, could have done things the way that I like things to be done, and he knows them to be done, because it is my body. So, but anyway, and what with the STD, the pelvic pain, you know, I liked things to be done my way, and the way that didn't cause me as much pain, or being completely uncomfortable being heavily pregnant. But anyway, so I remember the consultant looking and basically not seeing any fluid at all, even though she had pictures from her own ultrasound department and window to the womb. She still didn't see anything. So never mind, basically. Anyway, so at the 36-week scan, I believe it was, the growth scan, I mentioned to the sonographer about the fluid, and they checked the notes and everything. And she looked, and she did see it. So miraculously, it had come back. I don't think that was actually the case, but it was there. And she just said, luckily it wasn't as big as it was when Window to the Womb saw it, or her colleague. So she hoped that it wouldn't cause any problems when Penny was born. I remember we had the scan quite early in the morning, and we then had my last consultant appointment after that. And I believe I was 35 plus 6 or 36 weeks on this day. And we got in the room with the consultant, and she was actually my named consultant. But I thought, never seen you before. So it turned out she was the lady I should have been under the entire time. But this was the first time I saw her, and thank God for that. That's all I've got to say, is once was enough with that lady. But anyway, so I'd actually written out a letter stating my wishes based on what the midwife had said. And this consultant was not happy that the midwife had dared to tell me that this was a possibility. And the thing that I'd explained in the letter is that my circumstances weren't just I was bored being pregnant or anything. I was in agony, and the SPD wasn't making it any better. Being pregnant wasn't making my back any better. So there was a number of things that, I mean, this isn't a decision that me and my husband made lightly. This is a decision that we took a long time to come to. So when the consultant said, well, there are lots of risks, and she went through them, and I read them all, and I understood the risks. But they were very small. They were very small risks. So waiting another week and 5 days, I believe it was, wouldn't have made the risks that much less. So I believe it was maybe 5%. Anyway, so she explained that I would have to fill in quite a few forms, have a COVID test, blood test, and get steroid injections. I'd have to get 2 steroid injections 48 hours apart, so a few days before. So I remember, I believe we had one that day, and then 48 hours later came back for another one. And that was it, really. That was all we had to do. Because I was having a cesarean section, because the whole way through the pregnancy it was a planned cesarean section anyway. I don't remember when, but at some point near the end I did have a face-to-face with an anaesthetist. I believe most of the anaesthetist appointments were telephone, but because of the wheelchair situation, yeah, I'm a little bit more complicated, and what with other gastroparesis issues and things like this. So they wanted to, so I had the appointment with the anaesthetist. She wanted to speak to a neurologist that I was supposed to be seeing during that time, but because of pregnancy and COVID and things, but wanted to just run it by him basically. And so that's what she did. I then had a follow-up telephone appointment with her and one of her colleagues too. I believe it was her, maybe the person she answered to, maybe her boss. But yeah, so in the end, I spoke to, including on the day of the C-section, I spoke to 3 anaesthetists. They all said to me that the risks of doing a spinal block and making my back situation and me not walking worse and the pain worse and things like this were far less than the risks that if I had a general anaesthetic, that something could go wrong under that. They were all concerned more about that. because those were my options basically. It was a general anaesthetic or a spinal block. Now obviously I was really concerned about a spinal block, what with my spine already being a problem. I also wanted to be awake for the birth of my child because with Chloe and Kai, I remember in the C-sections you have the little window or screen sheet up, and they bring that down and lift baby up and say, you know, here's your baby, basically, and then, you know, somebody goes over, cuts the cord, and then bring baby over to you. Anyway, so and I wanted to be awake to experience the birth of my child. So I agreed with them that because of the gastroprocess that there are more, that ultimately it sounded like, they made it sound like there would be more risks with a general anaesthetic. So I agreed to the spinal block. So anyway, so the day of the actual operation, the cesarean, I phoned up labour ward as I was instructed, just to make sure everything was okay and there was no emergencies and things like that. And everything was fine. I was convinced they were going to tell me it wasn't, but everything was fine. So we went straight up to the hospital, to the postnatal ward, which is where we were instructed to go. As soon as we got there, before we even went through the double doors to get through to the corridor section, to go through double doors again to get to the beds, my husband was told he couldn't go no further. So again, we explained everything and didn't care, basically. That's what it felt like. It felt like they didn't care. But yes, so my husband, who doesn't drive, so we'd actually got the bus up there because obviously I knew I wasn't going to be able to drive after the cesarean. My husband had to get straight back on the bus and come straight back home. Luckily, we don't live too far away from the hospital. And before you think anything, Chloe and Kai were at my mum's. So they weren't actually here as it was half term. So anyway, so I got taken to the bed in the postnatal ward. I then basically sat there. They helped me onto the bed. I sat there and waited. I then spoke to an anaesthetist, the surgeon, nurses, I believe, students, I believe, quite a few people. They explained that I would be the first to go down, which I was happy about because I was extremely nervous. And so I remember asking, do we know a rough time so I can let my husband know what time to come up? No. So anyway, so they came and got me dressed. Again, I asked about my husband. Still nothing. They then said, right, we're gonna just gotta sort this out and then we're gonna wheel you down. I was like, oh, when do I let my husband know? Oh yeah, you should have done that by now. Great, thanks. Anyway, so I let him know. He then had to get up to the hospital as soon as possible. Like I said, they'd got me dressed into the gown, lovely open back gown. Luckily I was laying down on bed, and wheeled me through to theatre. They transferred me onto the operating table, sat me up, put the spinal block in and all that, laid me down, gave me the anti-sickness medications and whatever else they did, blood pressure, cuff and all this. They then was like, right, we're ready to get started. And I was like, hold on a minute, my husband's not here. I don't want to do this on my own. And they was like, oh, well, I'm sure somebody's gone to get him. So by the time, and then they started cutting. My husband then got in, luckily, with not much time to spare. He maybe had a few minutes, and that was only because of my previous C-section. So there was quite a bit of scar tissue that they had to cut through. And so luckily he made it in time. And then one of the midwives, I believe it was, said, oh, she's coming. They pulled her out, and I was like, okay, pull the curtain down now. And then she just appeared round by the corner of me. I was like, oh, okay. And then they asked my husband to go over and cut the cord. And so, well, they asked if he wanted to, he did. They did that, he did that. And then they asked whether or not I wanted to hold her. I was like, of course I do. So they put her on me, put her like right here, or just below my boob, sorry. And I had her there, and the surgeons behind the cloth kept whacking her in the head. I don't know what they were doing, obviously doing whatever it is they do after you've had a baby via cesarean. But yeah, and then so I said to my husband, you're gonna have to take her, because they keep hitting her in the head. I mean, she's a literal newborn. But I will forever be grateful that all three of my children, Chloe, Kai and Penny, were born safely, healthy. And Penny was no different. She was born happy, healthy, 6 pounds 2 ounces. So I did suffer some side effects after giving birth. Like, prior to giving birth, I could use my hands, so push down on my hands and lift my bum up effectively, and pull my bum over and transfer over, and someone would do my legs. So since giving birth, I can't do that anymore. I don't know why. But like I say, all three were come into this world happy, healthy and safe, and that's all I can ask for. My health issues are what they are, and getting pregnant and having a baby whilst being like this, I suppose always carried some tale of risk. But to have Penny in our lives was absolutely worth it, and will always be. Same with Chloe and Kai. Everything I've been through, everything I will go through, having them three in my life will always be worth everything that I've ever had to and ever will have to go through. So I do apologise for the length of this video, but thank you for watching. I really do appreciate if you've made it this far. If you could like this video and subscribe to my channel, I really does help me, and I really would appreciate that. I'm currently uploading videos once per week. I'm trying to get them out on a Monday morning. I do believe this one, however, will go out on Tuesday, as today is Sunday night. I will try to increase that to 2 videos if I can. But thanks for watching, and I hope to see you again soon.